Hi, I'm Dr. Michelle O'Donoghue, Brigham Women's Hospital in Boston, Massachusetts. I'm here in Lisbon at the EAS Congress and just presented data looking at lipoprotein a in FOURIER. By way of background, FOURIER was the phase 3 trial of the PCSK9 inhibitor evolocumab. It randomized approximately 27,000 patients with stable atherosclerotic disease to evolocumab or placebo on a background of statin therapy. In this particular study, we looked at Lp(a) concentration, both at baseline as well as the effects of evolocumab on Lp(a) at follow-up time points, including week 12 and week 48. What we found was that baseline Lp(a) was associated with an increased risk of coronary heart disease or MI. So it does appear to be an effective marker of risk. We then looked at the effects of evolocumab on Lp(a) concentration and saw that overall there appeared to be about a median 27% reduction in Lp(a) concentration with evolocumab when compared to placebo. This translated into an absolute reduction of approximately 11 nanomole per liter drop. We also looked to see whether or not baseline Lp(a) concentration predicted the benefit of evolocumab. And what we observed was that when we split baseline Lp(a) at the median and looked at people who fell above or below that value, individuals who had higher baseline Lp(a) were at higher risk of cardiovascular events and therefore had a larger absolute risk reduction when treated with evolocumab, translating into a lower number needed to treat. So the absolute risk reduction in terms of preventing cardiovascular death, MI, or stroke was greater for patients with a higher baseline Lp(a) than for those who had a lower baseline Lp(a). And in addition, individuals who achieved dual targets, so achieved both a lower concentration of Lp(a) in addition to LDL, were those who were at lowest risk of cardiovascular events. In contrast to those who achieved only one target, so achieved either a lower Lp(a) or a lower LDL value, but not the two in tandem, were at intermediate risk, and those who achieved neither were at highest risk. So from here, there's a lot of ongoing research looking at inhibitors that are specifically designed to reduce Lp(a). It'll be interesting to see as these evolve further, whether or not that further translates into a reduction in cardiovascular events.